Control, Dr. Ifedayo Adetifa, says recurring cholera outbreak in Nigeria is as a result of insufficient resources to keep the disease at bay. The DG revealed this at the National Strategic Plan of the Action on Cholera Control Review Workshop in Abuja. Our Northern Bureau Chief, completes the story.
The Director General of the Nigeria Center for Disease Control, Dr. Ifedayo Adetifa, said it will require funding and political leaders' commitment in the control of cholera. He said states need to know their outbreak levels and ensure a state-specific response to address issues like safe water infrastructure. Dr. Adetifa explained that the National Action Plan on Cholera of 2018 is being reviewed and updated to make it fit for purpose and align with the current realities of cholera in the country.
I am the incident manager reported. We are already seeing cholera cases in the country since January, and that's not surprising because cholera, Nigeria is described as what? Endemic. So we've got cholera normally, and then what happens is on top of that endemicity, you have outbreaks, which large increases in numbers of cases and associated deaths. That situation hasn't changed. Okay. What we have now is an increasing report of cases. We know that there's a seasonal exacerbation, so as the rainy season comes and contaminates water sources because of all the open defecation, then we get the epidemic proportions, which is like the major outbreaks of cases that we report, and a significant ramping up in the number of reported cases.
Okay, Nigeria is not the only country that is endemic in Africa, and it's also not the only one in the world. So, but in terms of the National Cholera Plan that WHO supported the federal government of Nigeria to develop, it's one thing to have a plan. The most important thing about a plan is its implementation. So I think the implementation aspect of that plan didn't go too well, and that led to us coming back to review that plan, to revise it.
The initiative, the GTFCC, is a long-term initiative, but it has become more operational recently, and it's an initiative supported by about 50 agencies globally, hosted by the WHO, and the IFRC, the International Federation of Red Cross, which I represent, host an operational arm of the GTFCC to support countries like Nigeria.
For example, we know what to do to end cholera, as the DG has also very well described. What the CSP, the Country Support Platform, is doing as part of the operational arm of the GTFCC is to work together with countries as a first phase to help develop national cholera plans that have a strategic component that really tell us how are we going to implement the global roadmap at a national level, how are we going to move there, following the guidance and the strategic lines from the GTFCC, and then as a second part, other than setting that strategic directive, to also develop the operational plan.
Dr. Adetifa said the Nigeria Center for Disease Control considers it essential to partner with several institutions as part of efforts to keep cholera on the public health agenda and achieve a 90% reduction in cholera deaths by 2030. From the nation's capital, Joycelyn Elakeche Ada, ABN News.